So we know that Indiana ranks pretty low when it comes to its healthcare system. For instance, some of the statistics show that it's worse than average, really. There are statistics that shows that Indiana may rank number 33 in its healthcare system. That's from the Commonwealth Fund. So with that, of course, the focus here is healthcare, access to healthcare, and specifically underserved populations that may be more unfairly affected by this lack of investment, if you wish. So speaking of that aspect particularly, how do you think your foundations might be able to perhaps fund some of those gaps, if you can talk about that? And Sarah, would you like to take that? I'm just going to go
Sure.
a little
We like to partner with
different.
and we do. Again, we provide a lot of operating support. We do provide opportunity for a direct program, and we do support organizations that are, I'll say, boots on the ground in terms of frontline supports for that purpose. But it is very important to us, and when you think about how key healthcare and access to quality healthcare is, especially for as you have a family, when you think about your kiddos and everything like that, it just changes the complexion of how you think about healthcare in our community. At least it did for me. When my son was young, you think, wow, this is, how am I going to navigate all this, right? How am I going to have an understanding? And then if you have an issue or you think about childcare and how that plays into it. And if you have a child that has needs, how do you navigate all that? And luckily, I think you would all agree that we have amazing supports, amazing organizations in this community that are very focus driven to really meet the needs of our families and kiddos in our community. So that's what I would say about that.
Thank you, Sarah. So, and I know, of course, Meg, for you, access to healthcare is one of the cornerstone purposes of your organization. Could you talk more about that?
Sure. We get these questions ahead of time, and I have to tell you, when Sharon sent this out, I've been thinking about this one all night, and it's a great question. It's also not an easy question.
Right.
Yeah. And I think it's really important to say the role is rapidly changing in this community of funding healthcare. And it's funding for a couple of reasons. Last year, there was a landmark decision that the state would start funding some public health pieces. And we got the first taste of it in Allen County in the fall, and those grants came out in December. That's a bigger piece will be coming out in 2024. And hopefully, if it's well documented, that will continue to change. With that evolution, there have been several phone calls with different funders learning what the government's doing, where do we come alongside. So this is, I think, has been mentioned by both Sharon and Sarah. Talk to us about your ideas, because we're all evolving with this. Where do we fit in and where become most effective? A general trend is what I would say is that pretty much very few of us will fund health care because of the insurance because we do have adult Medicaid, although it's not always adequate. It's, that's kind of, those are out there. More and more the research is saying that the community that you live in, or where you live and work, are the social determinants of health, your housing, your nutrition, those structures are making a bigger impact. And so I know for us, the social determinants of health, we pay a lot of attention to, and we will fund into those. And I think that's where a lot of discussion is. How do you go upstream to prevent health? So we're working, for example, a lot in nutrition that will offset a lot of chronic disease. And so that would be kind of, it's a great question. Whoever came up with it, I was like, how do you say a quick answer? So I hope that made some sense in that 2-minute answer.
Yes, of course. So the situation is evolving. It's very complex, it's very difficult to fund healthcare directly, and social determinants of health are extremely important to the foundation. That's what I'm hearing from you. And Sarah, you have a...
So the social determinants of health, and if you think about how all of that how all of that works together. And it's very challenging from a foundational perspective too, because you're talking about individuals, right? And moving an individual forward. We fund organizations, we tend to support organizations, and under the construct of developing a strong organization helps create better resources, stronger connections to the community. And it's subjective, but it's also, I think, a huge opportunity that we have in our community. We also have a lot of innovation happening with the healthcare systems that we have, with using the social determinants of health. I think about aging and in-home services, using the medical records and having interface with medical records for social aspects, so that ER physicians can see this individual that's been in the ER multiple times doesn't have supports at home, they don't have family, they don't have these needs. So how can we attach supporting that individual to provide a better opportunity for them to be more healthy and to have a better quality of life? So there's also those cool innovations that are happening, that are happening right here in this community, that have an impact not only statewide but also nationally, which is pretty cool.
And I don't want to speak for you, but my experience is that all three of these organizations are really open to conversations and hearing about innovative ideas.
Absolutely.
That's been my experience.
Absolutely.
So, Angela, what about you? Our community foundation, is there a focus on health?
There is, and over the last few years, the Community Foundation has gone through a little bit of a transition. So there was a vision plan that was enacted in 2020 to kind of capture a lot of the things that they're talking about, to just figure out what is going to better serve the community, looking at the community as a whole and the health of the community, and to figure out how to facilitate charitable giving, and then to also figure out how to use those funds to, impact healthy nonprofits who can then impact the community, and then also figure out how to develop leadership and support leadership with resources. So as part of that, it was looking at the community to figure out what are our needs, and they came up with these 5 pillars to focus on, like 5 different buckets that kind of what encompasses what's happening in Allen County. And one of those pillars is healthy mind and body, to have an intentional focus on funding organizations and programs that would serve healthcare needs. So if you're interested in applying for a grant under that pillar, that's once a year. It happens, the application opens October 1st. The deadline is November 1st. We also have other pillars that we fund under, so it just kind of depends on what your organization's mission is. You can kind of look on our website and see where you fall, and you can apply once a year under those programs. But it was really to just figure out how to support organizations who care about healthcare. But also we know that there are programs that need to be supported as well, so that's why we also have a program aspect that you can also apply for. So you can apply for 2 different grants, one for your organization and one for programming, and it's really to understand that this is a big need, and there are different ways to attack a need. And I also think that, foundations have a good position to be a convener, so we don't have to work in silos. We can be kind of neutral ground to bring folks together to figure out how to solve problems, because it's very hard to do all of this on our own. It's hard to do it on your own as a nonprofit. It's hard for us to do it on our own just as foundations. So it really is a conversation and a way to kind of figure out how to do all of this together.
And brainstorm who can support it now. Okay, so I want to look at, where's Sharon? Oh, here, hi. So, good with time, 9:50?
Yeah, I think we
Two more
might want to
questions?
start asking some questions of the people though, and see how many.
I just leaned over and asked her questions.
No, no.
So,
maybe you ask
let
one
me do
more.
this,
and
let
then
me
we
do this.
answer.
I have 2 more questions, and I'm gonna let you jump in, and then I'm gonna see if anybody else has a question, if that's okay. So because I would like to ask this question that I think would be helpful on, what makes an application more competitive for you, okay? So I'm trying to combine a couple of those questions you got ahead. What are some of the misconceptions or mistakes? So when you look at an application, what tips would you have to make an application more competitive, if anyone may?
Let me jump in to start with that. I would say, I want to answer it 2 ways. I think that the role of us who have the privilege of representing funds that aren't ours is to really understand the request as thoroughly as we can, so we accurately represent it. So if that's our job, to represent you, the most important thing is to have a well-organized proposal and make it as clear what you think is the compelling thing. So each of us have designs to tell you, fill in the blanks. Make it as clear as you can. Avoid acronyms, jargon. Just tell us what you're doing. Don't be afraid to reach out to any of our organizations. The most important thing is for us to honestly understand what you're trying to do. And so that would be my quick answer for you, because I think too often people think you have to be in the right jargon, or we really are trying to just understand the important work you're doing.
So well-organized applications, clear, concise, simple language, and you're also hearing, don't be afraid to outreach. One thing I found, correct me if I'm wrong as you answer this, you don't necessarily want to be surprised or hear something the first time when you get a grant proposal, perhaps. I don't know.
I would say don't hesitate to develop relationships with the foundations. Definitely reach out. I have meetings all the time with all kinds of folks, and it's just because there have been situations where we might get an application, the community members who are reviewing it don't understand it, but because I've met with that organization and I know what they're doing, I can better explain what's going on, because we've had coffee a couple of times and we've talked about it, and they've run their idea by us. So you can definitely reach out. I think there's this misperception that foundations are unapproachable and there's no way to kind of get to know anyone, but we're real people and we care about the community too, and we're just trying to figure out how to serve everybody. So yeah, reach out and just, I know that for the Community Foundation, our application is changing, and it's changing a lot, the one for the Rising Together grant. So there might be a lot of questions surrounding that. So definitely don't hesitate to reach out. I know a lot of organizations aren't often used to focusing on operational grants. So sometimes for an operational proposal, we'll get a lot of information about programs. And that's great, but also we want to know about the health of the organization, what's going on there. We're just trying to figure out, I think it's just really answer the questions that are asked. And I think sometimes folks kind of get in their heads about it and they don't. So if you have questions, reach out. That's my biggest takeaway. We are all approachable and we're happy to meet.
Okay, great. So you heard that. Sarah?
Agree with everything they have said. Reach out, talk about your idea, share data, numbers, support, the evidence of that the program that you want support for is working. The qualitative data is wonderful. We want to know the story, right? We want to know what's behind the program that you're or the operating support that you're asking for. But give us data, give us numbers. And it doesn't have to be, I think a lot of people have a concern, well, our writing style may not be as sophisticated as another organization. That does not matter at all. It's not a writing competition, it's a grant application. If you can be concise, tell your story, not, as clearly and plainly as possible. Our board is making the decisions for the grant making, and they're not living in the nonprofit world, so that I think helps the individuals that are making some of the decisions and supporting these opportunities be a little more in touch with exactly what is this request saying.
When you say data, local data.
Correct, if possible, right, as much as possible. And again, we have an Allen County focus, so if you can tell us the data for Allen County, that's what we want to know in terms of, even if you serve other areas, other counties, other populations, that isn't a ding or anything from, I serve people outside of Allen County. Tell us what you're doing in Allen County.
So I'm going to allow for some questions now. And then as I do that, I would like to also challenge you three, and that's a little bit outside, so take it if you want to, but I know that there's been a lot of talk about diversity for organizations. We all get grant applications that ask about, what are you doing for diversity and inclusion? How diverse is your board? So I like to flip it, if that's okay. Would you have any information about how you as foundations are perhaps working to diversify the pool of your applications and applicants? Just gonna leave it in there for you to think about, because again, it's a collaborative effort that we're all working together to support underserved communities. So I'll let you think about it. If you can answer if you have some specific ideas, because I didn't give you this ahead, but we have a question? Is that-
Yeah, my question to Sharon was just, is there a specific foundation in the community that specifically focuses on impoverished communities? Like, do you target zip codes? I mean, her answer to me was.
Well, let them answer.
Okay.
So specific focus on areas of
So like
neighborhoods
example,
that
I
poor-
was a pastor at Faith for the last 6 years. Well, that zip code has been in the top 5 poorest zip codes in the entire state for the last 20 plus years, and it doesn't seem like it's moving, and we have a lot of money in this community. And then, so with that, tying that second piece, and not just maybe specific to you, I mean, maybe you're aware of another foundation that is, if it's not just yours, but that's one, but then, that piece. And then the people that are working, a lot of times it seems like what always happens is the money goes to push people outside of the community to come help and have some savior mentality, and instead of empowering the people in the community to fix it. So that's just.
I think that is a really good question, and I think you have here a lot of experience, so anybody wants to.
I will take that. That's exactly our focus, honestly. Those most in economic need with the least opportunity. And when we think about, so we have a new initiative, it's, I guess not that new now, 3 years old, called the Thrive Initiative. And one of the things that we are doing is working with neighborhoods to understand how can we help best support in small ways, large ways, and doing true community development work with the neighborhoods is something that is a bit of a shift, I'll be honest, for us in terms of our grant making. Again, looking to provide a lot of the operating support, larger, more stable organizations, but how can we think differently about our opportunities that we have to support those exactly in our focus area, which we've been told by our donor to do. So that's something that we are actually working on quite heavily, and trying to involve some community members in helping us make some decisions in terms of how we can move forward with opportunities.
Okay.
Are we
Do you
still
want
on
to add
this
anything
question,
to
or-
this, and then we'll go to the next question?
I would just jump on. Sarah said, we also fund in that space. Our goal is the most vulnerable. We may slice it a little bit differently, but it's the same piece. A few things that are a little distinctive between us. We are a faith-based organization, whereas Angela said mind and body. We do mind, body, and spirit. We look for that aspect of it. Neither of the others, I don't think, get into as much faith-based. So if it's a church work or something, we're probably more inclined to consider it. We would probably do we do grassroots work. We love when our programs go to Foellinger, and they really do the development of the people on the front lines with some incredible training that we don't have the resources for. So it's not one foundation who does it, it's a combination of efforts. We look at the other grants, we do talk amongst ourselves, but we're driven by what our donor tells us to do, not by whether we like somebody or not. It's what helps us best advance that donor intent.
Okay, thank you, Meg. Question?
Yeah, I guess we all hear low income, but is there any funders among yourself that are intentional with BIPOC-led organizations, BIPOC grassroots-led organizations? It seems a lot of times the same people get the funding. And so is there anyone among you that are being intentional? Melissa spoke about zip codes. I mean, Pilgrim Progress Community Development Corp, we're constantly shining a light on East Central 03. There's been a pattern, a history of disinvestment. And so are any of you funders looking at this as being intentional, helping those grassroots BIPOC organizations?
You go. Okay.
So part of the focus of the Community Foundation is to be in the community more. I think that's something that hadn't happened for a lot of years. So I know that our CEO has a mission to meet every nonprofit at some point over the next couple of years? Well, right now there's about 2,000 nonprofits and it's just me. So I'm gonna get there. I'm trying, but I'm gonna get there. But I think that we have to be more intentional about being in communities and figuring out different strategies. So I talked about our operational grants, and yeah, you have to be in operation for at least 3 years. So sometimes that disqualifies grassroots organizations, and that's why we have our program grants. So there's still opportunities for newer organizations to get funding in our engaged grants. And part of it is just my charge is to kind of go out and meet with people and bring in grassroots organizations and meet new people. So I'm always looking for organizations to meet with. Sometimes people come to me, sometimes people recommend people to me, like you've reached out before and like, have I met with this organization? So I'm always open. I think it's just part of, make an intentional effort to do that. And that's really what I'm doing at the Community Foundation, is trying to reach organizations and meet new people and try to bring them into the grant making process, because I know a lot of times folks are excluded from funding opportunities.
Okay, so,
I think we have a question online, and then Denise. That's fine.
okay, Sharon says it's okay.
It says, unfortunately, Allen County isn't great at making certain kinds of data easily accessible. Is there anything at all that all of you as grant-making bodies can do about that or advocate for on behalf of grantees?
So access to data is an issue.
We will actually help you meet with some evaluators and dig into data. If that's something that is of interest, we can help put you on the right path to determining Allen County specific data. At times it just is a void of the data that we're trying to get or look at. So how else can you think about providing evidence of that the program that you're operating is doing what you really want it to do? And that's all we're really looking for with that.
So sometimes the pressure is to find the funding now, okay, write a grant application for the application that's due next week. I'll have it working ahead of time with some groundwork, the outreach, the development of your program, and the evaluation. That really is probably the path that would take you to incrementally higher amount of funding, probably, right?
I would also just say that there isn't good data in a lot of areas.
Right.
It's not current data. We know that. You just have to be honest and say there isn't good data. Let the funder know that. Again, it's been said a lot. Talk to us, especially in new areas. I would also add to that, we funded a lot of data collection
Right.
when we thought it was important. So we're kind of in this together. And so we also ask what data, I think the others are probably the same way. If we don't know an organization well, we want to know what you know. You have enough expertise and really good on-site intelligence about the group you're trying to serve that it'll be effective. So sometimes that's stories or it's anecdotal what you're going. I mean, so I think sometimes it's the stories are going to be more effective than it's the only data you have. But we have a responsibility to make sure the organization is well positioned to use those funds effectively. That's a lot of what we're looking for too.
Hi, if I could pop in for a second, this is Elka. And excuse me, I totally agree with that. I think the anecdotal stories are actually more impactful, but I also, as a data geek, I also strongly believe that numbers tell a story too. And it's just frustrating how hard, at times that I feel like I have to dig or search. I mean, I can usually find what I'm looking for, but it's very frustrating that here in Allen County, the information that I feel like I want or that I'm looking for about populations that we serve and the data isn't there on those populations, BIPOC folks, undocumented folks, immigrant and refugee populations, LGBTQ plus people, survivors of domestic, but like those kinds of data points are so hard to locate here in Allen County. So that was the basis of my question. And maybe it's something that all of you can, sort of work together on, sort of advocate for in some way. But yeah. Thank you for responding.
So I appreciate what you're saying, and I just wanted to share that we also understand as an organization that there is sometimes an undignifying component to asking a lot of questions of certain individuals. And so how can we work together to understand that in a grant application where we don't gather some income data, we don't maybe ask these questions because of this. And this is how we approach our the people that we're serving, that we're trying to support. So making that part of the story too can also, I don't want to say get over a hump of data, but help explain why you maybe don't have some of the data behind the individuals that you're working with. I'm thinking of people in domestic violence situations, really, really tough challenges.
Okay, we're gonna let Denise ask her question, and then for reasons of time, we're probably gonna stop here with questions.
Okay, that's fine. Well, first of all, I want to thank Sharon and Health Visions for doing this.
Yes.
Because before COVID, we would get together periodically. There used to be Meet the Funders,
Yes.
Things of that nature. Because when we collaborate on getting information, we all do better. But we also have to do a better job of documenting our own information within our own organizations and silos, because nobody else is going to have to keep that stuff but us, and that helps you give them a better grant. My question though for you as a team is, can you support us getting together collectively, minimum of once a year, so that we can meet and greet and talk and share? And secondly to that, especially to Foellinger, when Foellinger did their, was it 100th anniversary a few years ago, or 150? I get confused when you get those big numbers. Okay, there were 5 urban-based organizations that basically had the same need for transportation. And we thought, oh geez, what if we write this grant together? There was no way for micro, small, local organizations to effectively write a grant together, which would have strengthened all of them, and I think it would have been kudos to the organizations. So is that something in this day and age that we can begin to move into truly becoming a village?
Yes.
I would
say
yes.
We'll talk later. So need your answer, give me a call.
Okay, Meg?
I want to do a plug on behalf of all of our foundations. There is, kind of to your question, it hits some of Sheila's too. 8 local foundations have come together, and on February 14th, you should have all gotten an invitation this week. If you are funded by any of our foundations, and the 8 foundations are, the 3 of us are organizing. Let me tell you what the event is. We are bringing in, we brought her in last year, but an expert on governance, but specifically talking about purpose-driven leadership, which talks about intentionality of reaching into underserved populations. To your question, Sheila, the event is on February 14th, and we have gone to a great effort to all of us contributed, and Foellinger has gone above and beyond with the Barbara Burt Fund to add the extra funds to make it possible. There's 400 seats. And last year's 220. If everybody shows up, it'll sell out soon. It's free, but it really is to bring people together. All of us will be there to listen and learn collectively. But it is 8 local foundations. It's February 14th.
Where would this email come from?
Northeast Indiana Funders Collaborative is what we're calling our group of 8.
Meg, where do we register? Where do we find
Yes.
it?
You have to get the invitation. And you have to be funded by one of the 8 funders. And if you haven't been funded, reach out to me and let me know, and let me see if we can help on that because of the collaboration. But it does speak to both of what you're saying. It's for that. We went together and took all of our grantee lists and merged them. So it's a pretty robust list.
Am I on that list?
I'm not sure.
I don't remember Sheila's name. Where's
I will
700
find
people on
out,
that list.
but it's all it's by the organizations. It's whoever we fund it's by tax ID numbers, kind of, because that's how most of the systems have kind of done it. So Sheila, I'm not exactly, I mean, I know that I funded some things there, so you're probably on our list.
I would hope so. If not, I'm publicly letting everyone here to add me to the list.
Reach out to me and I will write down and try to look it up when we get back there. But that is the opportunity to at least hear more. It's a challenge to all of us to get stronger. And it's BIPOC. We're also equally concerned about immigration. We find a lot of prenatal. We would like more women on there, particularly Black women, Latino women, because of, we want better representation. All of us do inclusivity. How to do that with the right skill sets, talents, is challenging.
To be continued.
To be continued.
Yes. So, want to thank everyone for coming out today. I know this just scratched the surface of the idea of the concept of grant writing, and the tips and strengths and things that we need to build as organizations so that we can take advantage of the resources that are in the community. We got some resources in the community. The issue is, how do we seize on those? How do we seize those resources and use them for the greater good? So, you've now seen their faces, you've heard them speak, you have their names, and their contact information. We will be sending that out, or the appropriate person within your organizations give that to us, and we can send that information out with our next ACHEC email. So, if you have any follow-up questions, please don't hesitate to follow up with them as we send that information out. As I say, follow up with them because they have the answers. I want to just end this meeting really quickly. I know some of you have to go. We went a little bit over time, but it was an important topic. Just by letting you know that ACHEC, this is the Allen County Health Equity Coalition. That's what ACHEC is, for those who are unfamiliar. We invited people to come today because we wanted everyone to be apprised of this information. Now, if you have not paid your dues for 2024, we want you to pay your dues to be a part of the coalition today or as soon as possible, so that you can continue to take advantage of the information that we give at these meetings. So usually we'll have a presenter or two with some information that will help our organizations collaborate better, gain resources, or serve one another better, or network. So that we can be better leaders and better communicators and better servants in underserved populations. So any questions on that? We do have packets available. Okay, yes. We do have the membership packets available for those of you who don't know what I'm talking about.
Was there a renewal sent out to us?
Yes.
Thank you.
We flooded emails with that renewal.
I'm sure
that's
my
why there's
treasurer has that
Snickers.
information. I'm just asking. Yes.
Yes, and we do have packets here, Sheila.
Okay.
So you can take one of those with you. Okay. What was I about to say here? Yes, we also need those of you who are here to fill out your survey so that we can send that into one of our grantors and meet our deliverables there. ACHEC news, I'll say real quick, or Health Visions news. Hey, for those of you who do not know, I got a little promotion. So now I am the executive director for Health Visions Midwest. That means covering all of our three locations: Fort Wayne, Hammond, and East St. Louis. That also means that there will be someone new filling in my spot for the Fort Wayne position. And hopefully by the next ACHEC meeting, we will know who that person is, and that person will be in the room, and we'll be able to introduce you to everyone. I'm still going to be in Fort Wayne. I'm still going to be around in community leading, if that is a phrase to use, and so I will be here, okay? It's going to be a wonderful transition and change in our organization. Do we have any other updates for Health Visions? Okay, the Health Visions team says no. So what about in the room? What are your organizations, or what are you doing? If you want to tell us real quick something that's coming up.
I can probably share just.
Yes.
the excitement I also have for starting another role with Welcoming America starting February 1st. So I will be working to support their Certified Welcoming program, which supports the development of inclusive communities in the United States. So I'll be doing a lot of traveling, and it's gonna be interesting. This guy right here makes it possible, so be nice to him.
Yes.
And so you'll be seeing a lot more of Andrew, and you also will see me around as well. And yes, I will continue supporting projects on the side, but yes.
And this guy, for those who are online and didn't see that, this guy is her husband, Andrew Applegate. So yes, we're going to keep the camera moving as people are talking. Anyone else in the room?
At the Fort Wayne Housing Authority, we were awarded a $500,000 grant to revitalize the southeast side of Fort Wayne. So what we did was took one of our distressed properties, which is Tall Oaks on Decatur Road, if you're familiar with the high rises. So what we want to do is start off by doing community action plans. So a community garden, light flashers in that area for people that have to walk, to the grocery store. But what we want to do is bring in community partners as well to see how we can collaborate with funding and bringing in healthcare, education, and things like that. So we do have a town hall meeting coming up. And I can send that flyer to you to send out to everyone. It'll be February 15th from 5:30 to 7:30 at the McMillan Center. And there you'll get more information to see how we're doing this planning. And once we are finished with this planning, we can be awarded up to $20 million to revitalize.
Wonderful.
So what Larissa was talking about, for those of you who aren't aware, when she was talking about sending the flyer, if you are a paid coalition member, then we will send out information during our through our news and events email outs, which come out I think every other week or so. So that's how we do that. All right. Anybody else? All right. I think is there anyone online that had something that they wanted to share?
I didn't want to say it.
Okay, no raised hands online. All right, so okay, Brenda?
Can I make one last plug?
Yes.
That's general, has nothing to do with the organization I represent, but to see this full room again, like it was pre-COVID, is so exciting, because I think some of the relationships that you guys are talking about, coming together to collaborate, start in a room. So thank you guys for all coming back after COVID, and all the people that are online, come, fill the time, because I think the networking aspect of this group that's the main reason.
Okay.
Great speakers and all of that, I love it too. But the networking is just fantastic.
Thank you, Brenda.
They want to share online.
Okay, who is that?
Autumn, go ahead, Autumn.
Hi. Okay, I have two events that I'd like to share for Purdue Extension. The first one is happening today for anyone who has a remote interest in addressing substance use in Allen County. Purdue Extension is hosting our very first task meeting, introductory meeting. It stands for Taking Action to Address Substance Abuse in Communities. That's today at 11:30. I'll put my email in the chat, and you guys can reach out with any questions about that. We'd love to have you at the office today. We are providing lunch. And then the second event, on the 30th at noon, I am hosting a plant-based eating lesson on Zoom. So again, if you email me, I can shoot you the link for that. So those are the two events I wanted to share.
Autumn, what is your email address for people who are in the room?
It is ASTrice, TRICE, @purdue.edu.
Okay, ASTrice. I thought I could remember that, but I can't.
It's okay.
ASTrice something. At purdue.edu?
Yes.
Yep.
Okay, all right, awesome. So thank you so much. So what we're going to do now is the people who are in the room are going to be able to eat some goodies.
We have more announcement online.
What?
Connie Heflin.
Oh, Connie, okay, go ahead. We gotta let Connie go.
Hey guys, this is Connie with SuperShot. I just wanted to let everybody know that we have our grant with Aging and In-Home Services to provide uninsured adults with the shingles vaccine, and the RSV vaccine has been extended. So this is a great opportunity if you have any clients that are adult clients that are uninsured to get the shingles vaccine and the adult RSV vaccine, and for pregnant women to receive the RSV vaccine that provides passive immunity to their unborn child. These vaccines are really expensive, and there is no federal program that provides these vaccines for uninsured adults, but Aging and In-Home Services is paying for these vaccines through this collaboration that we're doing with them. So if anybody has any patients, this is extended through March 15th, and there really is no other way for uninsured adults to get these vaccines other than paying out of pocket, and that could cost them hundreds and hundreds of dollars. So if you have any questions or want more information, we are willing to come to you and help collaborate too. We go to Matthew 25 and provide these vaccines at Matthew 25. So we're willing to collaborate. And I apologize for my congested sound. I've got a crazy head cold, so that's why I'm not there in person spreading my germs. So thanks.
Did not even notice. Thank you, Connie. Okay, if that is all, then we will begin our networking time for those who are in the room until 10:30. Please enjoy.